Today I've got a video on IFAKs. IFAKs being individual first aid kits, and today specifically this one is on my hiking camping IFAK, not to be confused with my everyday carry one that I keep in my get home bag. But the purposes of these are a little bit different. My everyday carry one is going to be a little bit more, it's a different kind of trauma related than you need for hiking. So this has got a cat tourniquet on it, stuff that I generally would not need while out hiking. Hiking, camping, you're going to be more involved with scrapes and scratches and blisters and sprained things and, maybe dislocated finger potentially, but more of that type. So you're not going to need as much trauma-related exsanguinating legs that you are as to likely if you're going to be out hiking or camping. And so the bags are a little bit different. The pouch that I use for this is the Maxpedition individual first aid pouch, and I like this better. I've reviewed a couple other pouches and I've got some videos of them, and I like this one the best, so much that I've obviously bought two of them. The nylon on this, it's lighter weight, more flexible, softer. So let's look at the pouch itself first, just to show you. On the back there is some webbing. On the front here there's a pocket, there's a little carry handle here, and then there's these zippers with these big ties, or these big zipper pulls. Little tip for you, this has two zipper pulls, but for sort of ease of getting into, especially if you have this mounted on something, tuck that other zipper pull in there. That way you just need to grab that one zipper pull and zip out and around. This bag, I wish it came in a couple other colors, because for hiking, camping, I don't need a tactical color. Might even like a red version of this for that type of purpose. Again, I'm not out where people are shooting at me. I don't need camouflage. So, if I had a request for this bag, put it in a red color for availability. All right, so let's look at what's in this bag. Starting with the front here, there's a zippered pocket up here. And in here, aside from these, I've got some safety pins that I keep down here. A bunch of uses for safety pins. Keeping bandages together. You can use it to keep your pants together if you're somehow your snap falls out. Helping to get splinters out of things. Just hanging up your clothes. If you need them to dry. Just a bunch of uses for safety pins. Otherwise, in this pocket, I have some nitrile gloves. There's probably 5 pairs of nitrile gloves in a little Ziploc bag. One of the things with this bag is you need to decide, are you taking care of yourself, or are you making a bag to take care of other people? And if you're going to be taking care of other people, how many other people are you potentially prepared to take care of? For me, this bag is mostly going to be just for me, and so the contents of it are kind of geared towards that. So a couple pairs of gloves for if you are going to treat someone else, or if you're for some reason going to treat yourself and your hands are just absolutely filthy, you can use that. In this little Ziploc bag, I've got a couple different things. Some minor wound stuff. I have some bacitracin. So a couple different antibiotic ointments. Bacitracin is a single antibiotic ointment. People talk about don't use the triple antibiotic ointment. And as best I can tell, the potential problem with that people can have is that the triple antibiotic ointment includes neomycin as one of the 3 antibiotics, and some people can be a little bit more likely to have an allergy to that. So the single antibiotic potentially is, I guess, a little bit safer allergy-wise. Well, this is what we use in the ER. I've rarely seen people that have allergies to this, and I think I've never seen anyone say that, yeah, I don't need that triple antibiotic thing because I've had an allergy to it. But for what that's worth, the bacitracin is probably a little bit safer. Our burn service uses this as well, sometimes when they're not using Silvadene on simpler burns. There are some studies that say that Vaseline is just as protective and useful as the antibiotic ointments, and it's going to have less reactivity. There's the theory on that, but I use bacitracin anyway. We put it on our lacerations after we're done with them. Some alcohol wipes if you need to clean some things off. And here I've got a couple different sizes of Band-Aids. These H-shaped ones and some larger ones. These are kind of the stretchy kind, so you can put them over a knuckle if need be. And then on the other side here, a pack of Steri-Strips. Next is some moleskin. I've taken this pack on a couple different hikes. I've taken it 20 miles in the Grand Canyon and 40 miles in Rocky Mountain National Park. And I think for the most part, the only thing that I've used out of the entire pack is the moleskin. Works great when you're starting to get blisters. You want to get ahead of the blisters, not wait until they form, until it's kind of too late. So I cut a little piece of moleskin off, stick it where you get a little bit of a hot spot. Next, I've got a couple Tegaderms. Tegaderm is essentially almost like stretchy, sticky saran wrap. A lot of times we put it over IV sites in the hospital. But if you've got a small, simple scrape that you just want to kind of keep protected, or even sometimes the tip of your finger, it can work well because it wraps on there. It's waterproof. It can last on there for a while. No problem. Again, they're quick and light, lightweight, easy to get on there. This is Vaseline gauze. It will keep stuff from sticking to your wound. So if you've got a big abraded wound that you don't want to put a piece of gauze on that's going to stick to it and be miserable when you try and pull it off, put some of this Vaseline gauze on there, and that will help keep things from sticking to it. A step up from the moleskin is glacier gel, and this is a little bit more protective for a little bit larger blisters. I think I've not had to use these yet, but I think these are going to be a little bit more protective. And then a couple 4x4s. Stick all this back in here. All right, onto the inside. Grab that one zipper pull and pull it around. This bag has, for the most part, 2 areas. You could say that it has a third one. In my other bag, I keep a pair of scissors kind of sitting in here, and they just kind of sort of lock in there. First of all, I've got a Sharpie that I've got tucked kind of right into the spine here. It fits well there. If you need to write notes to people, if you need to write on people to mark things, you can use that. Over here in this pocket, I've got a few safety items. At the end, I'll talk about some stuff that I don't have in here that for reasons why I do or don't have it, or stuff that I could potentially add. But just a few safety things I've got in here. This REI signaling whistle, it is crazy loud, and a signaling mirror. Pair of trauma shears, great for cutting dressings and cutting clothes and bandages and things like that. Some wet wipes. I carry hand sanitizer, so I'm not going to use this for my hands, but if you need to clean off some part of your body that's gotten dirty, sometimes if you're out hiking, you need to go to the bathroom, don't have toilet paper, you can have those. An aluminum finger splint. Again, while you're out hiking, you're maybe somewhat likely to get a finger injury. You fall, get your finger, it can get dislocated, some type of injury, or you just need to protect it because you've got some type of laceration. Put the splint on there. These can be bended and molded. Some people will even take them and wrap them around the top of their finger. Lightweight, easy thing to stick in there. Little thing of saline, useful for irrigating eyes. Quick thing on wound irrigation. Tap water is absolutely perfectly fine. Whatever water that you have for drinking, you can use that to irrigate your wound. This is, I think, just a little bit easier for eyes because it's got this focused tip, and if you really need to irrigate your eye out with, granted, it's not a lot of saline, but that might be just a little bit easier to use, was my thought. Small pair of tweezers that maybe could be useful for help getting splinters out, small things like that. And then some combat gauze. Again, I don't think with hiking that you're going to need a lot of big exsanguinating wound type dressings, but this is the Z-fold gauze. It's not the granule. It doesn't create an exothermic reaction. And the way you take this is you just take it and you shove it down into the wound. So if you've got a wound that you really just can't get to stop bleeding, this can be useful for putting in there. And again, it's pretty lightweight. Fits in the package pretty easily, so I thought I would throw that in there. And over to the other side. This zips all the way open and opens up this way. In here, an ace wrap dressing. I could potentially, might be better, I maybe get one of these 6-inch ones. There's plenty of space for it right here. Probably get a 6-inch ace wrap and put it there. A little bit better for wrapping bigger joints like a knee or something like that. Some Body Glide. This is anti-chafing. Kind of put it on like deodorant in places where we're getting a lot of chafing, you know, maybe between your thighs, or if you're out on a long hike, anything that might be getting a little bit of a hot spot. Here are 2 different kinds of tape. Some Transport medical tape. This rips really nice, great for dressings. And then a little roll of duct tape. Tons of uses for that, obviously, and they handily fit right over each other. Triangle bandage. Triangle bandages have millions, maybe not millions, but a lot of uses. You can use it as a sling. You can use it to help put a splint on. You can use it as keep your dressing on your head, on different parts of your body. Just tons of uses for triangle dressings. Definitely include one of those in your pack. Coban. This is tape that sticks only to itself. It's useful for sticking on wounds, helping to wrap a finger. It's also kind of very moldy, as in you can kind of mold it and wrap it around, and it sticks pretty well like that, and it's not going to pull your skin when you go to take it off. And then this is just kind of a big compressive gauze dressing. Again, if there's something a little bit bigger that needs a little bit bigger dressing, then one of those 4x4s, and again, sits in here pretty easily. So those are pretty much the contents of the package of my IFAK. Now, some things that I don't have in here, there's no drugs in here. And that's because if I'm going on a small hiking trip, most of my hikes are day hikes, in which case I don't need a lot of drugs. But in Rocky Mountain National Park, we were out camping for a week, really away from any real medical care. So I take some drugs, and I initially had started putting drugs in a little small Advil pack like this, and you can really only fit a couple things in this. And I think in my get home bag, I have one of these, and I have some, I think, Motrin, Tylenol, and Benadryl. But for hiking, especially if you're going to be camping out for a while longer, what I've done is I've gotten this little fishing sort of tackle box. And I've taken it and I've labeled it, as you can see here, with different drugs. And the things that I keep in here, I need to restock this a little bit. This is going to depend on where you're going, what your needs are going to be. But down at the bottom here, I had some vitamins. I took one of those every day on my trip. Some Motrin. Pretty much every day on my last trip, I took a Motrin and a vitamin, and that sufficed fine for up to the altitude that I was. Tylenol. FYI, you can take Motrin and Tylenol together because they work differently. You can take the Motrin 800 every 8 hours, the Tylenol 1 gram every 6 hours. Take them together if you like, if you need a little bit extra pain killing. Avelox, some antibiotics. Avelox, fluoroquinolone, it's great for a ton of different things. It will treat traveler's diarrhea, like a lot of people use Cipro. It will treat pneumonia, it will treat upper respiratory respiratory infections rather, although a lot of those are viral, in which case you don't need any antibiotics. A lot of bronchitis is viral, but if for some reason you're out somewhere and you really need some antibiotics, Avelox is going to be great for respiratory stuff, for skin infections, for diarrhea. This is what the military keeps in their IFAKs, I believe, as well. So good choice there. It's not a cheap drug, depending on how your insurance goes, but good drug. Diamox, if you're going to go up to altitude, I'm going to Everest next year, and so I've got some Diamox. Might want to see how you tolerate it. Some people don't like the side effects of it, but you can take that, and that'll help with the mountain sickness or the altitude sickness. Up here, I have some Allegra D. Uses both a decongestant and an antihistamine. Over here, some Zofran. It's a nausea medicine. These are the Zofran dissolvable tablets. They just dissolve on your tongue. Put them in there. You can't throw them up, because if you're out somewhere and you've got vomiting and you don't want to have to deal with it, take that. On the back here, granted I've only got 4 of these, but there's some Imodium in here and some Benadryl up here if you're having some kind of reaction, bee sting, and you want something different than the Allegra. So I'll restock this a little bit more when I'm going to be gone for 3 weeks when I go to Everest next year. But this is how I carry my drugs for longer hiking trips when I want something more than just a few pills of each. All right, so other than that, some other stuff that I don't have that I should have that I carry in a different way. A knife. I always carry a Leatherman juice when I'm going on my hiking trips. It's small, it's lightweight, it's got pliers, it's got a knife. A bunch of useful features in this. Aside from that, I always have some other form of knife. You know, I have any here. I think on my last trip I took my my CRKT. What is this? My M1612 Zlek. Got a review of this. Great knife. It's lightweight. I didn't want to take anything that I was afraid I would lose. But that's a nice knife. Flashlights. I always have a flashlight. Have a headlamp usually when I go camping. I have 1 or 2 flashlights that I keep with me. I always take some bug spray with me. A lot of the stuff I just have separate because my IFAK is going to be a little bit more emergent type stuff. And the other stuff I'm going to use a lot more. Bug spray, hand sanitizer, sunscreen. Something that you could talk about putting in here would be a lighter, something to start fire. If need be, if you might get stuck somewhere, that's something I might add to this. Again, a lot of my hikes are day hikes. Some of them are camping. So I probably will add a lighter to here for that. What about Dermabond or Crazy Glue? Some simple wound closure stuff. If you've got a wound that doesn't need sutures, that doesn't need staples, it's small, you want to get it back together. In the ER we have Dermabond, it's the medical grade cyanoacrylate. Super glue, Crazy Glue is pretty much the same chemical composition. So you can stick some Crazy Glue in there if you like. Yeah, cyanoacrylate. So that's same chemical composition as the Dermabond that we use in the ER. It's not sterile, but likely it will do okay. Don't put this on any type of wound that is likely to get infected, like a bite. Otherwise, I think that about covers it. This pack weighs 1 pound, 6 ounces. Haven't weighed my pill bottle, but it's pretty lightweight as you can see. It works pretty well. It's well organized. So that's what I take camping. So let me know what you take if you've got a different set of contents for your IFAK when you go hiking. Anything I might add, anything I forgot that I might add. But otherwise, there you go. Appreciate you watching, and I will catch you next time.